Starting today, you can open enroll for health care through the Affordable Care Act, widely known as Obamacare. We've been telling you about changes to expect, like an increase in premiums and fewer insurers to choose from. Federal subsidies should lower the overall cost for many people, but needless to say, you want to take your time and make sure you know what you're signing up for. You have until December 15th to enroll for coverage to begin January 1st. Donald Trump said today if he becomes president, he'd immediately convene a special session of Congress to repeal and replace the Affordable Care Act. More than 350,000 people in Kansas and Missouri are signed up for the Affordable Care Act currently, and those numbers are increasing, but so are the costs. The Now Sarah Hall did some digging to help us navigate what can be hard for a lot of people to understand.
You know, I have a hard time doing it through our employer. Imagine doing it on your own. So CNN Money just put together this really helpful tool just to show us exactly how much premiums are increasing. Come on in here, Wayne, and let me give you an idea. On average, it's about 25% across the nation. In Kansas, though, 42%. In the state of Missouri, it's about 18%. And while most premiums are on the rise, most Affordable Care Act consumers actually won't notice an increase because of tax credits, which help offset the monthly costs. Jim Torres, a health insurance expert at Samuel U. Rogers Health Center, says one reason insurance costs are increasing is because many of the people who signed up for the ACA were people who were in desperate need of health care.
People who really needed insurance were the first to get in the marketplace. Those who were older, those who had more health problems, those who had more chronic conditions, those who were more expensive to insure. So they use more health care services than the insurance companies had planned, so the premiums have to go up.
All right, so open enrollment starts today. It goes through January 31st, 2017, and that is to get you insured for the year of 2017. So you'll head over, if you want to do this, you're going to head over to healthcare.gov. You're going to enter some basic information like your zip code, your age, your sex, and then you're going to go ahead and continue. We're going to continue here. Now, I put in my age from my very first job. Now, keep in mind, in TV, when you start out, you're not making a whole lot of money, so I'm just going to put $20,000. You're going to continue, and then it's going to take you over to this page telling me I can save about $191 on average because of those tax credits. Now, Wayne, come on over here and let me give you an idea of what this page looks like. Now, this is going to tell you all of the plans available. With the information I put in, I've got 6 plans available. My average monthly premium is going to cost me about $137. That's with those tax credits. You can see here, this is the price it was. This is the price I would likely pay. Now, one important thing you're going to want to look at when you're doing this is your estimated total yearly costs. And this is because while your monthly premium may be low, your estimated total yearly cost could be higher. So it could be to your benefit, Krista, to get a higher monthly premium if it ends up being less.
Lower down there.
Yes, exactly. So
the deductible has to come into play too. I mean, it's a lot to understand.
It's a lot to take into account. Now, if you have questions or concerns, there are healthcare navigators. They will help you for free.
All right, this is helpful to watch you kind of walk through it. You're no longer 25.
I am no longer and not anywhere near 25.
All right, thank you very much, Tara. Great to explain it.